Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health related for women. Thank you for joining me here today at GYN Corner. This is the Facebook Live presentation, and I'm going sideways because, as I mentioned yesterday, sorry, there's a fly who loves my hair. I put essential oils in my hair. I'm going sideways because the YouTube presentations, I just use my cell phone for these. The YouTube presentations, everything's all squished and narrow. So I thought I would, until I can get a better video system, I'm going sideways because it looks better on the YouTube. So I'm going to kind of go back and forth on being sideways on Facebook and looking better on YouTube versus looking normal on Facebook and then looking scrunched up on YouTube. So hopefully before the end of the year I can get my act together with the video system. I'm not super techy. So let's see, today is hump day. It's Wednesday, October 9th, and as I stated on the information on the title, I'm speaking about Dong Quai again. And yesterday I gave information about Dong Quai, and I mentioned that I'm speaking about it because it's a traditional Chinese medicine. It's been used for thousands of years for a myriad of problems. It comes from China predominantly, but it's also produced in Japan and Korea. And Dong Quai is what we call it. The scientific name is Angelica sinensis, and in the traditional Chinese medicine, it's called Dong Quai. It's also known as female ginseng because of its invigorating effects for female reproductive aspects. So I'm speaking about it because years ago in the mid to late 90s, I had a lot of menopausal patients who were using Dong Quai for perimenopausal symptoms. What we call climacteric symptoms, so hot flushes, sweats, irritability, mood swings, emotional issues, the usual. And for whatever reason, I think it kind of fell out of favor once a lot of the push for hormone replacement for menopausal women, for estrogen and progesterone hormone replacement fell out of favor, I think is when women decreased using the Dong Quai. And it also got a little bit of a bad rap for some of the potential side effects for it. I remember this was a nationwide issue with some of the potential side effects, which I'll go into momentarily. But recently I had a young patient who started using and asked me whether or not she should continue using Dong Quai for really bad menstrual cramps, for dysmenorrhea. So she had a history of being doubled over in pain, missing school and now work for the first day or two of her cycle. She started using the Dong Quai and it decreased the cramps, relieved it enough where she's able to now function, just takes a painkiller or two. So it made a huge difference for her. So, as I mentioned yesterday, the Dong Quai has a lot of health benefits. It also has a lot of supplements that's rich in. So it's rich in vitamin A, B3, vitamin C, vitamin E, cobalt, biotin, potassium, magnesium, and iron. And the active ingredients, which really is thought scientifically to give it its gusto for why it's so helpful in certain aspects of healthcare, is ferulic acid, coumarin, and lingustolide. Now, I looked those up because obviously I'm not an herbalist, I'm a gynecologist, so I'm familiar with the usage of the herb, but not what the ingredients were. So I looked up those ingredients, and it makes sense why the Dong Quai is being used in certain aspects of medicine. So the coumarin has an anticoagulant effect. It's a blood thinning effect, and it's used in medicine, we use warfarin and coumadin. Those are derived from the herb coumarin. So we use warfarin and coumarin for an anticoagulant for patients with like mechanical heart valves or who have had pulmonary emboli or deep vein thrombosis. So that plant gives us the medication coumadin and warfarin, and it also has a small component in Dong Quai. Ferulic acid is an antioxidant. So antioxidants, I think we all know from the dark fruit, dark berries like blueberries, raspberries, and such. Antioxidants fight free radicals, and free radicals are the cause of oxidation and tissue damage, so they help decrease the physical effects or the manifestations of aging. They use it a lot in beauty products for wrinkles and sagging skin and such. And then the last one is the lingustillide. This one has an anti-inflammatory effect. It vasodilates, and it's a muscle relaxant. So those three active ingredients lend the reasons why we use it for certain health aspects. So the Dong Quai for women is used for painful periods, dysmenorrhea, the muscle relaxant effect, and the vasodilatation or the blood vessel dilatation effects would lend the explanation as to why it's helpful for menstrual cramps. We also use it for perimenopausal symptoms. So again, hot flushes and sweats, the vasodilatation, and the muscle relaxant. But also the Dong Quai is what we call a phytoestrogen. So its chemical effects also are seen in the body as a mild or a weak estrogen, and we treat hormonal problems with hormones. So the weak estrogen effect is going to explain why it's really helpful with hot flushes and sweats, and for some of the hormonal mood instability issues, emotional, angry, irritable, all of those. Also why it's used in premenstrual symptoms, PMS or PMDD, because of those same phytoestrogen effects and the muscle relaxants. It's also used in menstrual migraines, and the lingustillide would explain that, because menstrual migraines are from vasoconstriction, so the vasodilatation or the expansion or the dilating of the blood vessels, increasing blood flow, and the phytoestrogen because of the hormonal aspects of it. It's also used for infertility, for women with irregular or abnormal cycle lengths, spacing. So it helps to, as the phytoestrogen, it helps to support the female hormones, which is predominantly estrogen, and increase more regular and consistent ovulation patterns. Now, of course, all of those statements are not founded in human studies, but they have been fairly well supported in animal studies and chemical research for the ingredients and what those ingredients do. The non-gynecological aspects are that a lot of the traditional Chinese medicine, they use it for high blood pressure and for arthritic issues, for joint pain, and they use it for anemia, so iron deficient anemia, because it does have iron supplementation in it, and for constipation, because most likely because of the vasodilatation aspects, and estrogen also helps increase bowel motility to some degree. So those are interesting aspects for the Dong Quai, and the way people can use it is a myriad. They come as tinctures, so you can find them at all the health food stores, online, or as we call it, brick and mortar. So they come as tinctures, and depending on the type of Dong Quai, how it's been produced determines the concentration or the strength of it. So you can use several drops, you can use 3 to 4 drops, drops, or you can use 10 to 15 drops. Most people will drink it as a tea, so an herbal supplement in a tea. Some people will rub it directly on their skin. For some of the non-gynecological aspects, it's used more as a direct application on the skin, and for the GYN aspects, it's usually used as tinctures or drops in a tea. Now, the potential adverse effects or side effects, one, you're not supposed to use it if you have any kind of hormone sensitive cancer. So endometrial cancer, breast cancer are classic. You don't want to use it for if you've had a history of those cancers, or you don't want to use it for long periods of time or in very high dosages if you're postmenopausal. Because of those estrogen effects, it can potentially increase the risk of endometrial or uterine cancer and the risk of breast cancer. So if it's used postmenopausally, it really should only be used briefly, sporadically throughout the year. So I tell women 6 to 8 weeks or 3 months max, or use it until you see an improvement in your symptoms and then stop, and then use it again when you see an improvement in your symptoms and then stop. So usually a 2 to 3 month time period, and then take a break for at least 3 to 4 months or 6 months ideally, and then go back if your symptoms really start to rage. Not supposed to be used in pregnancy because it hasn't been tested on humans, definitely not developing humans, which are babies. So I wouldn't use it in pregnancy, and I also wouldn't use it if you're breastfeeding, because it's going to get into the breast milk and be delivered to your baby. And not supposed to be used if you're already on a blood thinner, because of the anticoagulant or blood thinning aspects of it. And let's see. There have been anecdotal reports or sporadic hither-thither reports of people having issues with high blood pressure, even though it's a muscle relaxant and it has vasodilatation aspects. If you're on blood pressure medications and you're taking it, it can either have the expected effect where your blood pressure may drop too low, or a weird effect where it may rise because it's a weird interaction with whatever medication you're on. It could potentially cancel out the blood pressure medicine that you're currently taking. So I hope that's been helpful information on Dong Quai, a traditional Chinese medicine used quite a bit for treating female problems or reproductive issues. Thank you. And if you have any questions or any concerns, please post the questions here on the Facebook channel. Please check out the YouTube channel, post any questions or topics for ideas, and let me know if you like what I've been presenting, if you have suggestions to go into further information or to delve deeper, or to, as they call it, to niche down. And please follow the Facebook, please subscribe to the YouTube channel, and check out the podcast. We're on 8 different platforms for the podcast, including Apple iTunes, Google Podcasts, Spotify, and Anchor. Thank you very much for joining me here today. This is Dr. McDaniel at GYN Corner, and please click the like button, subscribe, and follow to get a heads up on when I'm placing more presentations and what the topics will be. Have a great rest of your Wednesday. Be back at the next presentation. Bye.